As you heard, the resistance to antimicrobial medicines, not only antibiotics, but it is also antiviral drugs, we see it in HIV, antimalarials, is becoming the key problem for the future, the key problem for sustainable development. If we know that today 1.2 million people die directly from resistant microorganisms, and mainly bacteria, 4.5 million are dying because of comorbidity with this bacteria. This is the situation today. The estimate is that in 2050 it will be 2 million people dying from resistant bacteria. And I'm saying that this is an optimistic prognosis. Because if we continue this way, it is just going to speed up. Bacteria have no borders, viruses have no borders. COVID was a good example of that. We can all sit down in our houses, but this is not going to stop. The issue here today is that we have to go in the clinical sector, and this was the meeting today, and I'm really grateful to the university clinical sector, Docent Norčić, Professor Bejović, everybody for hosting it, because today we had all hospitals from Slovenia coming together, reaffirming Slovenia's commitment to fight this scourge, but also looking at all the elements, because antimicrobial resistance and resistance to antibiotics is not only one program. It also has to do with infection prevention and control, it has to do with diagnostics, it has to do with treatment, but it has to do with behavior of people, of everybody. Not only health workers, but also of the population. And unfortunately, the problem is bigger because it goes beyond the human and health sector. We know today in the world, and this is what the World Health Organization has been discussing together with all United Nations and with leaders of the world in the United Nations General Assembly this year in New York in September, where there was actually a high-level meeting on antimicrobial resistance, because it is in the agricultural sector as well. I'm very proud to be in Slovenia because whenever I go to the shop I can see meat without antibiotics. And that means not that the animals were not cured of a disease with antibiotics. It means that the agriculture is not using antibiotics in the fodder as a growth stimulator. So we have a wider problem. There is even a wider problem because unless we have a healthy environment, a clean environment, and what does that mean? It means wherever you have a hospital and people are taking antibiotics, whatever goes into the sewage is burdened with antibiotics. I'm not talking about only discarding everything, all the materials where antibiotics were stored in. That is also a problem, but that can be cleaned up. But the sewage is another problem. And then you have the pharmaceutical industry everywhere in the world. Now, antibiotics are critical. They are miracle medicines of the 20th century. If we do not stop the resistance now, in 10 years we will not have medicines to treat very common diseases. Very common diseases. People will die again of sore throat, of tonsillitis. People will die of appendicitis. People will die of things that we have forgotten that people can die from. Why? Because we have the miracle medicines. And this is really a miracle. So we have to really protect it, keep it. And once again, I'm really grateful. We have heard today really good results, but we cannot sleep. It is like diphtheria. It is like other communicable diseases. We become victims of the success. Slovenia has really been successful. It has really kept under good control the situation, but in order to do the program, we need financing, we need political commitment, we need sufficient number of health professionals at every level. We cannot expect nurses to have to grow another pair of hands, or 3 or 4 pairs of hands, to be able to clean the hands every time they stop doing something on one patient and go to another patient. And this is the critical thing. So we have the knowledge, we have the understanding, we have the surveillance, we have the equipment, but we need really all to work together.